We're thinning out here. We are very pleased to welcome Allison Pack, or Dr. Allison Pack from Remo Health. She is the Director of Evaluation. Allison, I don't want to eat up too much of your time. We got a couple people coming, grabbing their coffee, so I just was going to make one announcement before you get started. Is that okay?
Absolutely.
All right, very good. So somebody came up to me earlier, thank you so much for the question, and asked, actually, let me ask the right person. Orion, would you mind coming up for 2 minutes while people come back? Somebody asked me, well, what is Benjamin Rose? And I thought nobody can walk away from today's conference without a good answer to that. Thanks for letting me put you on the spot. Sure.
So, all right, because I can talk about Benjamin Rose if I can't talk about technology. Yeah. So thanks, Kylie. I'm Orion Bell. I'm the CEO here at Benjamin Rose. And if you're not familiar with us, we are a Cleveland-based nonprofit that focuses on older adults and family caregivers. We are a provider of services in Northeast Ohio for everything from Meals on Wheels to our Rose Centers for Aging Well to financial and counseling and wellness programs. And we're also an applied research entity. So you heard from Sylvia a little earlier. Sylvia is one of our research scientists here at Benjamin Rose. And so we have this unique role that we are a service provider as well as being a research organization and work with aging service agencies all across the country, particularly on things like family caregiver supports and dementia, social service, dementia interventions, things like what Sylvia described to you there. We are a local nonprofit. We're always looking for volunteers. We're always looking for folks to engage with us in doing that. And a number of the folks that are here today are folks that we have some history with, either as research partners or volunteers or participants in programs. So it's good to see all of you here today too. So thanks again for being here. Thanks for using our space. That's why we have it. And I'm going to get out of the way and we can hear from the smart people.
Great. I am requesting access to share my slides. We can do that. Okay. Let me move a few things out of the way. And okay. Can everyone see the slides? I hope. I'm sorry?
Yes. Yes.
Yes. Okay, great. Excellent. Well, thank you so much for the opportunity to speak today. It has been an amazing conference, from robots to music to art and generative AI. I'm really excited to take home some lessons learned. So honored to be speaking with you all, and thank you, Kylie, for the introduction. The title of my talk is Telehealth for Dementia Care. And I'll give a brief introduction and then review the impact of dementia across the United States, propose telehealth as part of the solution, and then give the example of Remo Health and conclude. So my name is Allison Pack, and I have spent my career researching strategies to help people use evidence-based practices in healthcare. So evidence-based practices are the interventions and services that rigorous research says works. But as we've seen here today, just because something works doesn't necessarily mean that people will use it. So researchers will recognize this as the field of implementation science, trying to figure out what strategies, what acceptability, what feasibility is needed to make sure that that product is being used. At Remo Health, I use those and other skills as Director of Program Evaluation, and I am also personally and deeply interested in evidence-based practices for dementia, because both my dad and my uncle are living with Alzheimer's disease. Other than that, I don't have any other disclosures. So let's jump in. I want to revisit the question at the heart of today's conference. Can technology solve aging's toughest challenges? The presenters who've come before me have shown us, among other things, that technology can be used to prevent social isolation, maintain quality of life, and even to exert agency over decision making. But what about someone with dementia? Can somebody with worsening memory loss be helped by technology? My purpose today is to convince you that yes, technology can help people with dementia and their family caregivers to prevent social isolation, maintain quality of life, and exert agency over decision making. Now, telehealth isn't for everyone, but I hope that you will join me in seeing how it can be a useful tool for very, very many people. So to convince you, I want to start by setting the stage. Let's talk about the impact of dementia across the United States, and likely for some folks in this room. Alzheimer's disease and related dementias we know are progressive, incurable neurodegenerative disorders. And the true prevalence is unknown because many people are not getting formally diagnosed. But we have estimates of about 7 million people in the United States who are affected by dementia. And that prevalence is expected to double by 2050, meaning that dementia and other progressive illnesses like dementia are, it's a public health crisis. So if you will, I'd like for you to take out your phone, and we'll infuse a little technology into the tech conference. If you could scan the QR code, please, and add your response. So the two questions that I have here with Slido are, has your family been affected by dementia? And then the second one is, did that person receive a formal diagnosis? And if you're like me and you have multiple people in your family, just choose one. Just curious about the prevalence of folks being diagnosed. So I will go to another slide. I'm not sure if you'll be seeing these. Let's see. You can add your results. Looks like we've got some coming in. 17 folks, 18. So it looks like what we're seeing here, we've got a mix of responses, right? With more people being affected by dementia than not. And then the second question, did that person receive a formal diagnosis? You can hit the next button on your phone. You should be able to answer this one as well. Okay, great. So also a mix here, though not quite as big of a span. So it's even flipping here. So kind of half 50-50 here with those saying that the person received a formal diagnosis and then those saying did not. So go back to the slides and get there and hit the next one. In fact, if someone in the United States is diagnosed with dementia, 85% of those diagnoses are happening in primary care settings. I think I need to move that over there. Okay. But study after study has shown that there are numerous barriers to quality dementia care from primary care in-person settings. And so studies have shown that primary care teams themselves are reporting the lack of confidence and continued education that they feel they need to be able to deliver the quality dementia care that they want to deliver and they feel like their patients deserve. Again, studies with primary care teams have shown that they report limited time and resources necessary to talk about dementia and have meaningful conversations about it. I mean, think about it. Primary care providers are doing so much in a single visit. adding a conversation about dementia into a time-boxed setting, especially for some people, it can be, a little bit of a stigmatized or a conversation that carries a lot of emotion. And so fitting that into that time is really difficult. There's also systemic inefficiencies in incorporating others into care. And by others here, I mean other family members, because we know as dementia progresses, the burden is really going to fall on the family members. And so incorporating family members into that care, incorporating other services into the care. I know you mentioned earlier about memory cafes and involving folks in senior centers, or there's plenty of other resources within the community to pull on. Pulling on those in a primary care setting is difficult. And then others can also mean specialists. And so speaking of specialists, if primary care is strapped by working on so much, and then should we be putting dementia care onto the shoulders of specialists? The problem is that in-person specialists can't be the only viable option. There simply aren't enough of them. The US has half the number of dementia specialists needed right now to take care of the cases that we have. And most specialists are concentrated in urban medical centers. So you think about the Cleveland Clinic or partnerships between Case Western School of Medicine and UH Cleveland Medical Center, or even Ohio State University's Medical Center. They're all largely concentrated in urban areas. So people in rural communities are left to leverage the ER for dementia care, but that's reactive and it's costly. It's not an evidence-based practice for prevention or symptom management of dementia. So all of this together means that as the dementia cases are rising and the number of specialists are remaining low, we are setting ourselves up for failure if that's the system and the only system that we have. So again, what is the solution? I'm arguing today that telehealth has to be part of the solution. Physician telehealth has nearly tripled since pre-pandemic levels. So the American Medical Association recently reported that it increased from 25% to nearly 75%. And then patients like it. And a 2024 national survey across the US found that 2/3 of people reported telehealth. Their virtual services were as good as in-person services. So you might be thinking, all right, access and use of telehealth is growing, but we're talking about older adults here. We're talking about people in rural areas or low-income communities. Earlier, I believe Susan mentioned, debunking the tech myth that actually there's a lot of older adults who are using technology. So 2/3 of older adults aged 50 and older are using technology and have used it for telehealth in the past 12 months. And an AARP report found that they liked it. 90% were satisfied with their experience. So, it is being used, telehealth is being used effectively and is enjoyed by older adults. What about those in rural areas? Well, there was a 2024 KFF report that found 25% of Medicare beneficiaries in rural areas were successfully using telehealth. So it's 25%, it's not amazing, but it is something. And these are folks in rural areas that are using telehealth. And then the same report showed that actually use is higher among low-income communities than it was among others. So folks in low-income communities are using telehealth as well. Now again, telehealth for dementia care is not necessarily something for everyone, but it can, and I think it should be, part of the solution, even and especially for older adults in rural areas and low-income communities across the United States. So I've got one more interaction for you. If you can, one more time, we'll take out your phone and scan the QR code to add your response. I was just talking about some potential barriers to telehealth with access and use. But I'd like for you to think creatively about what are the potential benefits of telehealth for families affected by dementia. And we'll take a look at the results. What we should be seeing is this word cloud come up as individuals put in the benefits that they see to telehealth for families affected by dementia. All right, we've got connection, peace of mind, accessibility, access, peace, convenience, partnership, not affected by long ER wait times. Great. Timely care. All right, we see these accessibility, convenience, access are the largest ones on this, meaning that there have been more people who have said this as well. See a couple more folks typing, so I will, okay, that's great. So this is sort of where we've landed, it looks like, more or less. Accessibility, convenience, access, and peace of mind. All right, thank you. And I'll get back to the slides. Okay. The thing is, telehealth for dementia care works, and there are many benefits to it, and you've reported on a number of them already. And also, it's been working for decades. So for multiple decades, we've been using components of telehealth, think phone visits even, or video, then eventually video visits. But we've been using that for decades to diagnose and support dementia. And then I know that the researchers in the room like Cochrane reviews. I love looking at Cochrane reviews. So a 2021 Cochrane review revealed that telehealth has similar accuracy for diagnosing dementia as in-person assessments. And then it also leads to positive outcomes. So among other things, it's the same outcomes that we've talked about already. So the that are on this slide, right? So improving quality of life and exerting agency over decision making. All of these are super, super important and not the only outcomes that we've seen. But telehealth isn't new, so I'm just want to reiterate that. It's not something we've adopted overnight. It's not something that came out of the pandemic. We've been using components of it for decades. And there's plenty of rigorous research that backs it up. There's a lot more studies than I have time to talk about, but on this slide, I've put some of the most pivotal. And so we can see here that in the 90s, we had the New York University had the caregiver intervention study. So it was a one-on-one caregiver intervention where they were training caregivers to people with dementia on how to care for them and how to keep them safely at home. The results showed that the one-on-one training, in-person training, was able to reduce nursing home placement by over 1.5 years. So again, focusing on the caregiver had benefits for the patient. And then in the 2000s, we sort of had this aha moment where the REACH trials showed us that hybrid models were just as effective, both for outcomes that affected the patient living with dementia, the person living with dementia, but also for the caregiver. So hybrid models being, again, some in-person sessions, one-on-one sessions, but also some phone sessions and some video visits. And then fast forward to about 10 years ago, we had the Alzheimer's and Dementia Care Study and Care Ecosystem. These were two very seminal studies that came out of California, and they were the first ones to have a telehealth first approach. So they used remote caregivers, remote care navigators to work with the caregivers. They also had 24/7 caregiver support. And the exciting thing for many folks in this these two studies was that not only did they have benefits for the patient and the caregiver, but they also had benefits by saving Medicare dollars. They saved hundreds of Medicare dollars per patient per month by helping them stay out of the ER. So even this morning, I know Dr. Kolo was talking about the potential financial modeling of, what kind of benefits could the robot keep for people to keep them out of the ER and stay in their homes longer. Well, the same thing happened here in these studies, where they were saving hundreds of dollars per month by keeping people out of the ER. So all of these studies together are super pivotal, and they played a role in policy decisions that we have today. And so the Center for Medicare and Medicaid Services recently released a national reimbursement model for team-based dementia care. It's a competitively selected model, so meaning that healthcare systems are competitively selected to participate, and those that do are able to give their team-based dementia care services to those that qualify at no added benefit, no added cost, lots of benefits, no added cost to the patient or the family. And so it's really instrumental. And all of this shows that there is both research and there's funding for dementia care through telehealth and team-based approaches. So at Remo Health, we are a CMS Guide participant. Guide is the name of the program, right? And we offer team-based dementia care virtually. So I want us to think about how it works in practice. And you all already used some of your own creativity to think about the benefits of dementia telehealth. But if you're comfortable, if you could please close your eyes and imagine with me. So imagine it's 3 a.m. You are a caregiver to your mom who has woken up and is hallucinating. You're not sure what to do. You panic. You get her into the car. You drive her to the ER, because that's the only place you can think of to take her. Hours later, you're exhausted. You're sent home with a very large bill and not a lot of clarity on how to cope, what to do next time when she might hallucinate again. It's scary. Now open your eyes. If you had access to 24/7 specialist nurse line, that stressful, costly ER run could have been avoided with a simple phone call and some practical tips on how to calm your mom, how to calm yourself. You'd be talking to an experienced clinician who specializes in dementia care. Again, an ER is a great place to go if you've got an overdose of medication or a fall, but it wasn't built for dementia. And so at Remo, our physician-led interdisciplinary care teams support every dyad all the way from diagnosis, so we can diagnose, all the way to end-of-life care. And our care navigators check in monthly. They find resources in the community, again, those memory care cafes or adult day centers. Those local services can help combat social isolation and improve quality of life, as can the monthly touch points, just to say, hey, I'm here, I can listen to you, I care, you're not alone. And then our social workers can help families plan for the future. So they try to do that as early as possible, involving the person with dementia so that they can exert agency over decision-making about what happens to them in the future, right? So they can have a say at the table before the disease progresses. All of this together, this entire team is meant to reduce costs, both to the family and to the healthcare system, by giving people the chance to stay at home longer with better quality of life. So in addition to our interdisciplinary care teams, we also leverage technology for ongoing support by using a 24/7 specialist nurse line. So Again, that was research-based. We've seen studies for decades show that that kind of support is really needed and beneficial. And then because we know it's important for people to have access to in-person doctors and to maintain the relationships they have with their primary care physicians, we partner with practices, including ones like the Cleveland Clinic. And what this does is it's multifaceted. It helps us provide comprehensive care to our patients, and it also reduces the wait list problem. So someone mentioned that as well earlier today. Like, the wait list problem is problematic. Cleveland Clinic will tell us, hey, instead of someone waiting 6 months to see our neurologist, they'll refer to us, where we'll say, okay, you can book an appointment with and see a neurologist within 2 weeks. The other thing it does is it reduces the cost of having to drive. So cost being not only the gasoline, but also the time and effort it takes. And when I hear that, I think about my dad. I think about trying to get him dressed and ready and out of the house at a certain time. And then if the drive is long, I'm going to think about, all right, I can't leave him alone. So if there's a need for a bathroom break, where am I going to stop? Because it needs to be somewhere that has a family restroom. So again, partnering with primary care physicians and practices like Cleveland Clinic is super beneficial, not only for us, but also for the people we serve. And then we have audio and written educational content. And I know Sylvia, when she was speaking, she talked about the need for low literacy, plain language educational materials on dementia. And we have that in our online library. Some of the materials, they're all available, written content. Some of them are also available to listen to. And we have a podcast called Talking Dementia that folks can listen to. And then we have a community of 25,000 plus members. Think of it like an online forum or Facebook, even without images. These services, between the audio and written content and the forum, the community, are meant to let people know between visits that they're not alone and that there are solutions out there for them, and we are there. This slide shows some of the posts, although I've taken out the names of people who have posted, but some of the posts that people have had in our online community. You can post with your name, you can also post anonymously, but it gives individuals a chance to share what's bothering them, what they're looking for, and someone from Remo Health, an actual person, expert, will respond, but they can respond to one another as well. So you can see here everything from sort of like hallucinations to bathing to memory loss. So family caregivers, but also people with dementia are posting on this forum. And then it's well received. So we have a quote here from a member who says, "I'm so grateful that Remo is doing this work, because if you don't have the resources or you don't know where to go, it can be very, very lonely." So again, I'm a researcher, and I know there's a lot of researchers in the room. Someone's going to ask the question, what's the evidence? Well, we, like a lot of you who've presented on your studies, we've done qualitative and quantitative research on our services. And so a qualitative study of 26 patients and caregivers showed that telehealth for dementia, our population, our services, was acceptable, and feasibility was sort of mixed. So some people had a hard time accessing and joining. But when they were able to work with staff to say, all right, let me show you how to do it, and then they were able to get on, it became very feasible for them. And so, for some people, additional help is needed, but the acceptability was widespread. In a 3-month pilot with 120 dyads, so patient caregiver dyads, we were able to reduce ER visits from 2 to 0.8. We also reduced falls from 3 to 0.6. And then those are patient scores. When we look at caregiver, we used the Zaret form. It's a validated survey. and we were able to reduce caregiver burden using Xerit to measure that from an 11 to 6. So very exciting outcomes, both qualitatively and quantitatively. But we are a new company and expanding. So I started the talk hoping to convince you that technology and telehealth in particular is an evidence-based, it's feasible, it's acceptable for families affected by dementia. It can help to prevent social isolation, it can maintain quality of life, and it can exert agency over decision-making. It can help people to do all of that. I sincerely hope that I have done my job, and I thank you for the time to speak with you. This is my contact information. And I'd be happy to share the slides, and I've got a lot of references in here as well, so you can take a look.
Thank you so much, Allison. Would you mind 1 or 2 questions from the audience?
No, not at all. Yeah.
Right. Does anyone have any questions? All right, I know we're getting to the end of the day. I don't see any. Well, thank you so much, Allison. You all have information about Remo in your folder, so please check it out. They have a great community for family caregivers and resources, so I really appreciate your time. Thank you so much, Dr. Pack.
Thank you. Bye.